So we are live now, and want to say that Dr. Susan Chambers, who started the Lakeside Women's Hospital, is here with us today, and Dr. Kyle Toll, who is at Norman Regional Hospital, heart surgeon.
Correct.
And also Kathy Cruzan, who runs Funds for Learning, is with us as well, small business owner, and knows a lot about what's going on about small business in Oklahoma, but around the nation as well. For those of you who don't know who I am, I'm Terry Neese. I'm a small business owner, founded Terry Neese Personnel Services, 37,000 jobs that we found for people. And in addition, running as your next Congresswoman from the 5th District. And I will be a proud member of the congressional delegation for Oklahoma. So we want to talk tonight about, or this afternoon, a little bit about the COVID-19, what's happening. Is it going to ramp back up? Those kinds of things. And then also on the small business side, how has this impacted small businesses? We know that there was a survey done recently. 25% of the businesses that answered that survey said they would not be in business after this is over. We know that there are a lot of small businesses that have applied for the PPP and not received it. We know a lot who did receive it. So we're going to talk about all of those things. I think everybody is a little bit tense about COVID-19. And there's a lot of talk about when are we going to open business back up? When are you going to allow us to have the essentials in business and the non-essentials in business? I'll lay all of that out to just say it's important that we get some of this right. And I think we've got the right people here on this program and Facebook that will tell us. So Susan, let me start with you, and let's just kind of talk first about where you think we are, and then Kyle, and then we'll have some questions.
Okay. So in Oklahoma, there's currently still a daily 4 to 5% increase in reported cases. So it's still critically important for people to stay home and social distance until it's safe to do otherwise. There's lots of talk out there about when that's going to be safe, but we need to listen to the folks that are telling us what to do. And right now it's still stay home, social distance. Social distancing is probably going to go on for much longer than we would anticipate. Maybe not to its level right now, but to some degree. So if you go out, stay 6 feet away, wear a mask if you're in a community area like a grocery store. I see most people doing that, but still some people aren't. It's still very important. So I still think everybody should go to the CDC website or the Oklahoma State Department of Health. They are your best resources for factual information. They have great information about almost any question you might have about COVID. Now, the symptoms of COVID have expanded from the original trio of shortness of breath, fever, and cough. They now include chills, repeated shaking and chills, muscle pain, headache, sore throat, and a new loss of taste or smell. They're both on the CDC website and the State Department of Health website. There are self-checker guides or symptom tracker guides so that you can actually go to that and see if you have symptoms that you should be seen about. And it'll tell you if it falls into the COVID or not, and if you really should contact somebody. There are also 24-hour COVID hotlines. So even though the COVID concerns are, of course, at the forefront and the focus in healthcare, I also believe it's really important to remind everyone to talk to their healthcare providers about any continuing care for other health issues or preventative screening that may have been postponed or just not done in recent weeks. There are certain treatments and tests and procedures that are necessary for people to stay healthy. And so you need to think about that so that you can keep yourself well and not just put things off. Lots of folks have put things off out of the fear of COVID, and then their disease processes have worsened. So take a little inventory of yourself. What would you normally be doing? Does it need to be done now? If you have a question, you have a symptom that you're not sure about, talk to your doctor.
I got a
Don't skip-
question for you right here. I go to the grocery store. They're saying you shouldn't bring bags into your house. You should leave them out in the garage or somewhere, and even wash everything down. Is that really what we ought to be doing?
Go ahead.
Yeah, it's Tony Fauci, who's my source on all this stuff, thinks it's very unlikely to get COVID from the cereal box, for example, the packaging and things that are generally safe. I know there was recently a time where a known COVID patient was coughing all over stuff, and some store had to clean out all their stock. And so barring that kind of bizarre episode, I think that that the current recommendation is to not use reusable bags, but and they've gone away from, most places have gone away from plastic to paper, because paper is also more resistant to COVID. I suppose in the final analysis, nothing's going to be perfect. And if you want to wash your cereal boxes, that's probably okay too, to spray them down. But the general consensus is that you don't have to. And I would echo what Susan said. I think it's very important for patients to remember that, because what we're finding is a suppression of people coming in with heart disease, for example, and they're coming in a much more severe state. I go work in a COVID hospital every day, and I actually think I'm more likely to get COVID at a Walmart than I am at a hospital. So don't be afraid of going to a hospital. They have very stringent guidelines and cleaning practices they take. And we've got patients that have been right next to COVID patients and not had any problem. So don't be afraid of hospitals.
So Kyle, is Norman Regional Hospital a COVID hospital?
Yes, it is.
Okay.
Yeah, we have a COVID unit, and we have 2 hospitals, the Healthplex and the other place. And we have a COVID unit at the Healthplex, but at the other hospital, we're taking care of them in the ICU. There's not a dedicated unit, but they've had no cross infections or any problems. The nurses are excellent at their care, and just room to room, and we've not had a single episode of that. So
That's great. Susan, I interrupted you. Can you?
No, I was really about done. You know, I just like Kyle said, you know, we're worrying a little bit more now about people who put things off, and you know, how that ripple effect is going to be. And as we get to open up a little bit more and have a little more room to see patients that aren't just absolutely critical, then I hope people will just feel the ability to discourse with their healthcare providers, so that they can at least have a conversation to be sure that, do we need to be seen right now, or is this something that really can wait till June or whenever?
Okay. Kyle, talk to us a little bit about what's how do you think things are going? Are we in the surge, or is the surge ahead of us? Your thoughts?
I think if you look at and this is just from the state website, that the cases are continuing to increase. I read it's the federal guidelines for when to open businesses. The phase 1 calls for a decrease in cases over a 14-day period. We are currently not there on that. If you look at daily cases, daily new cases, we are, but our total cases are still increasing. And I think it's right now there's a popular push around the country for protesting to go back to work, and I understand their concern. But by the same token, I would just refer to the federal guidelines, and when you have reached that state, I think you're safe. But if you have an increasing daily caseload, which we do currently in Oklahoma, I'm talking about total cases that are being treated, that's not a time to just say, okay, we can drop the mask and go back full to work. And there are some very important, and even when you do pass the guidelines, there's some very important things. And I think it shouldn't be lost on people that testing is the key, being able to test and track. And we don't currently have the capability of testing. The federal estimates are for the nation are 20 to 30 million tests a day, and we're not anywhere near that level right now with testing ability. And just in brief, the reason testing is so important is because you have to move to a model of containment where you're actually finding who has it, who they contacted, testing them, isolating them, and rather than mitigation, which is where you're just trying to keep people in their house. And that's kind of what we've been doing. So we have to move to the more advanced model where we're very aggressive. Just a little side note, Germany, when they did their first locus, they found the case, traced it, and it went to a salt shaker at an auto parts store, which I think is really unique because that's how aggressive they were. And they then contained it. And if you read the stats, you can get on the WHO and read, they've had very, very few deaths. They have had a fair number of cases, but they've been able to catch them early and isolate them. So that's how aggressive you have to be, though. And we can't do that right now. They tested all those people who touched that salt shaker and found the ones. So
the salt shakers. So what's your opinion about when will we have enough testing that we are not fearful of the fact that we don't have enough?
I don't really know that answer, and I don't think it's not present right now. I got the impression just from the federal guidelines that they thought that there's some debate about that. Some people seem to think we have plenty of testing right now, but they can't test at the level they need to do contact tracing, which is a very simple term for you have a new COVID case, who have you been near in the last week? Go and test all of them, and then limit those people from going around and spreading. And that's how you have to do that. And if you multiply this by thousands of cases, and it's going to be millions of case tests a day, and we currently cannot do that. When that day will come, I think we'll be pretty within the next month, I would think. But I think this rush to everybody just to go back to work without the testing capability, Dr. Fauci, and this isn't me saying that, but he's very concerned that we could have a second spike, which would, and what people need to realize is that could actually be much more harmful than continuing the mitigation efforts until the tests are available to do containment. Okay, she keeps poking my leg, so I'm gonna be quiet.
So for those of you out there that are watching the Facebook, these two are husband and wife. And
that's why we're sitting less than 6 feet apart.
That is true.
Dr. Toll and Dr. Susan Chambers. So we're going to have some questions for you a little bit later, but I'm going to switch over to Kathy Cruzan, and who is one of my favorite small business persons in the world. And I know she has really been following many of the options for small businesses to be able to stay in business. And I will tell you that I have been talking to a lot of small business owners that don't think they will be able to stay in business. That's a really sad comment to make. And I am praying to God that that doesn't happen. Kathy, I want to let you talk about what you know. I know that we just passed legislation, and I'm sure that you have all the details on that. And I have a few of them, but let's hear what Kathy Cruzan has to say.
Okay, thank you, and thank you, Dr. Chambers and Dr. Toll. I actually will take off. So they did just reach a deal, and it has passed the Senate. It's got to pass the House, and then the President signs it. It's an extension of the CARES Act. So the CARES Act passed at the end of March. And that's where we saw some of these small business loan programs come out. The first one being EIDL, which is a disaster relief loan, and that's been available through the SBA for other natural disasters, and the coronavirus was declared one, first in a handful of states and then really across the nation. In addition to that, funds were made available in what you're referring to as the PPP, which is the Payment Protection Plan. I think that was a fantastic idea by Congress, and I think it really is designed to help keep small businesses such as myself in business for a long term. It's really an 8-week time period that these small businesses can use these loans. During that period, if they use them in a certain manner, the way they're intended to keep employees employed, they can get total forgiveness of the portion that's used like that. The problem is it ran out of money in 2 weeks. So that's the challenge, and that's where we're hearing a lot of frustration and concern. A lot of small businesses that applied is obvious. So if you are a small business and you missed out on the first round, there now is additional funding that's available, that should be available this week. They put into it there's about $310 billion available for the payment protection plan. In addition, another $60 billion into the EIDL plan. I'm not sure how they came up with these amounts, especially EIDL. I'm having a difficult time finding data on what was processed in the first round. I could find quite a bit of data on what was processed on the payment protection plan. For example, the Wall Street Journal indicates that about 1.6 million applications were processed and funded. So that's a lot of businesses that may have been saved by it. But again, I think most of those businesses had relationships with their banker and were able to get on it quickly, were aware of it. And the businesses that were slower to that missed out on that first round of funding. And they're calling this CARES 2, so it's an extension. To tack on what Dr. Toll said, a part of that and part of the negotiation that's been happening over the last 24 hours was an additional $25 billion to expand testing. Because we know that's key. In fact, Funds for Learning, we're a small company. I have less than 30 employees. I plan to be about 4 weeks behind everybody else. My sole business is based on the services that the team provides. So without my people, I don't have business. And I've got to take care of the staff, and I've got to keep them healthy. 20% of the workforce goes down, we're in a lot of trouble. So I need to kind of be behind. Now, my business is able to do that. There are other businesses that can't work remotely. And in that case, I understand that they're under a lot of pressure to get the doors open and get the doors open to the public. But I think the key is the testing. We know that they're expanding the testing funding with this packet. Out of that $25 billion, about $11 billion are going directly to states. Part of the agreement that they have negotiated is that there has to be a national testing plan. I don't know what that looks like, but there has to be a national testing plan. So that's some information that's helpful for me to know, because what is the plan when we go back to work? How do if I have an employee that tests positive, the salt shaker example was fantastic. Like, how do I then track that employee through the office to determine who else needs to be? And some of it is just structuring before we go back and trying to separate us all. So we're going to work remote, and then we're going to work remote in the office.
Yeah.
So that's a lot of information, but I think I think if you're a small business and you've missed out on that first round, or you still have an application pending, I'm not sure about the EIDL there's been a lot less information. I don't personally know any businesses that have been successful there. Many of them have pending applications, not denied. I know of quite a few that were successful with the payment protection plan. Most of those got it in within the first 2 to 3 days.
Right.
Yeah.
Kathy, the big issue, I think, on the PPP is the forgiveness.
It's fantastic.
And, people are really scared about that. They don't want to spend the money. They don't even want to spend a dime of it right now. There's people thinking about, let's just give it back to them.
Yeah.
Because we don't know
I would encourage
or
them,
not.
if they received the funding, if they were one of the lucky ones, one of the 1.6 million applications that got funding, payroll expenses, payroll taxes, up to about 75% of the loan. So let's say we have $100,000 and $75,000 of that has to go directly to payroll. And they need to verify that they're not reducing their staff or reducing the pay of their staff by more than 25%. So there's some key factors. The banks helped get these loans. The banks are tracking this really well. Work with your banker. There is some disparity. I've noticed, just like when it originally came out, there was misinformation or different information. There's not a lot of information about the details. So some are taking the approach that it's an 8-week period from the day you get it. So some are taking that approach that it's like what is spent during that 8 week. and others are what you would typically spend. So payroll is usually paid in arrears. You might want to make sure that it's like the payroll expense incurred versus the payroll expense paid. I think those are kind of, potato, patata. I think just document it and understand there's some risk, but to get a loan that could possibly be completely forgiven is a huge gift.
Mhm.
And regardless, it's a loan at 1%. So the EIDL loan for most businesses that are not a nonprofit is about 3.75%. So there's a big difference in the loan amount. So if you need this money to sustain your business, I encourage you to use it, document it, maintain records of what you spent it on.
Right.
The EIDL also has a forgiveness in it too, but they call it a grant. So when you apply for the EIDL loan, you can ask for a $10,000 grant. They have kind of changed the requirements on that, so this is important to know too. So the first week, the information just said you could ask for the $10,000. A week later, it did say that it was $1,000 per employee, up to $10,000. So if you're a small business and you have 3 employees, the most you would qualify is $3,000. But that's a complete grant. It's just a gift at the beginning. Also, they'll fund pretty quickly the $25,000. The other rumor that I'm hearing about EIDL, and it may have been the lack of funding, they're running out of funding. The other rumor that I'm hearing is that they're capping it at $15,000. That does not really make sense to me, except it may have been at the end when they were running out of funds. The website clearly says it's up to $2 million. So I think it probably depends on the amount of funding, but if you need a loan, and that's better for your business rather than a payment protection, and it really depends on the type of business you're running and where your expenses are. If your expenses are in payroll or your expenses are in goods and shipping, you may really defer to one over the other. But again, I encourage you to be ready to go this week with applications. They're both very simple, short applications. The EIDL can be done directly online. The PPP application goes through your bank. So they can provide it to you. Again, it's about 2 pages. You have to do the calculations because it's based on last year's payroll information.
Right.
Okay. So let's, by the way, we put out a notice earlier today, this morning, actually, of people to send questions that they have for you. So let's try to do a couple for each of you, and then we'll stop at this because I know people probably are going to leave us and go do something else this evening. Let's look at the medical questions that we got. One is, why are so many local hospitals laying off staff considering the reported seriousness of COVID?
Well, I can answer that from a smaller hospital anyway. Most of our employees haven't been laid off, but some have had significantly reduced hours because, for example, in the surgical areas, because elective surgeries are not urgent surgeries or cancer surgeries have been postponed because of the need to make sure we had enough PPE, protective equipment. And that's the main reason, as well as just more people in the hospital and social distancing. But in my personal hospital situation, people haven't been laid off, but they have had significantly reduced hours and even had to apply for unemployment, which is horrible, but with the hope that fairly soon those hours will increase and they'll be right back. But I'll let Kyle speak to a much larger hospital, at least from what he knows.
Right. So the way to think of it is that you had to go into battle mode to have enough equipment to fight the COVID when it first broke. And so we cut out elective surgeries to maintain supplies. And a couple things happen when that happens. Hospitals generally generate most of their income from elective cases, not emergency cases. And so the funding fell off. So we did exactly what Susan described. We have cut hours for a lot of our employees, which still is partial unemployment if you think of it that way.
It is.
But so that's a tragedy. But it's just that our patient volume once you take the elective stuff out, that's a significant fraction, and we're still short of PPE at our hospital despite doing that. So it's good that we did that, but we still were using masks and using them all day long. And so when you hear people say on the news, oh, well, that's a problem that's solved, it's not been solved. And we still have to worry about that.
I would also say that, just for people who aren't in the medical field, elective surgery doesn't mean it's not an important surgery. Those surgeries are still very important. But lots of cases, even some cancer cases that don't need to be done right now, are put off. Even though, so elective sounds like it's like, oh, you didn't need to have it done. You still need to have it done, but because, like you said, it's battle strategy that we had to delay some of those. And that's hard from an employer and employee standpoint, as well as a patient standpoint.
And the second part of the question was, they're cutting off staff in light of the COVID being so severe. It's actually the opposite of that. What we've done is focused. For example, the brave young nurses that work in our COVID unit every day they have all the PPE they need. Every bit of PPE is shunted to them. And same way at Porter campus also. So our sole focus for the last really month has been how to take care of these COVID patients safely and not have any spread within the hospital, which they've accomplished 100% because of their dedication and the fact that they focus solely. So it's the opposite. It's actually that we're laying people off because we're focusing solely on COVID.
Okay, great. One last question to you. I know all the things that we need to do to try to keep ourselves safe, masks, washing our hands, all those things. Is there one other thing that we ought to do that we're not doing to keep ourselves safe from getting the COVID-19?
No, there's a game our kids used to play, The Floor is Lava. And I tell people that the world is lava. And so everything around you should be regarded as COVID possible. And so don't touch your eyes, mouth, or nose with anything that's lava. Everything around you in this room right here is lava. So, and then wash your hands before you eat, and then use hand sterilizer. Wash your hands often, because washing them is actually removing the carcasses of the bacteria, if you will. So it's very important to do that. But I think the thing that people need to realize is everything is a risk. And when you go to the grocery store, same way, you're touching that, when you're touching your wallet, wipe down your wallet when you go home.
Gas pump.
Be a gas pump. Nothing can be considered, oh, well, that's a gas pump, and so just consider everything a threat, would be the thing we do. It's not how we do it in the hospital. And then everything you ought to see the ritual the brave young nurses do going in and out of the rooms. They wipe their mask down, they wipe this, they wipe that. They have it's this bizarre ritual, and it's 100% effective.
Yeah.
So,
that's great.
Everything's a threat.
Thank you. So Kathy, I have a couple of questions for you as well. And, you've talked about several different options on how we can keep Oklahoma small business owners going. How do you feel about small business making a comeback in Oklahoma after COVID? What are you hearing from business owners? I mean, I'm talking to a lot of them. You're probably talking to a lot of them. Are they going to be able to remain in business based on an 8-week window here that they're actually dealing with?
I think there will be some that don't make it through this. And certainly if we were to have another surge, they wouldn't make it through a second round. I feel like as a community where we can help out is making purchases from small businesses, ordering online, doing everything we can to support our local businesses, because I do think there are some that are in real trouble. 8 weeks doesn't sound like that long, but it's a long time when you're trying to cover payroll and expenses. My other advice to small businesses is if they have leases, to reach out to their creditors, to ask for delayed payments. Really, it may take a while, you have to get on the phone, but I think the world is aware of this pandemic, and I think if there's an opportunity for forgiveness or some grace, ask for that extension of grace and see what you can do to try to extend this until you can be back and operational again.
Okay, that's good. What businesses do you think have been hit the hardest? Is it the restaurant industry?
Oh, I definitely think the restaurant industry has been hit the hardest, but honestly, Terry, I don't think there's any business that hasn't had some sort of an impact. I mean, asking about the hospitals, I mean, so you think they're working around the clock and yet they're losing revenue, and so I really don't think any business has been spared some type of financial and certainly inconvenience in this. I think everybody's been impacted. It's not like anything I've ever seen. And nor do I hope to ever see again.
Yeah, amen to that. So we're going to sign off, but I just have to say, these are three of my very best friends, and I don't have them on because they're my very best friends. I have them on because they have a lot of knowledge, and this is really great information for everyone that will watch this and soak in what Dr. Toll has said, what Dr. Chambers has said, and what Kathy Cruzan has said. And by the way, Kathy is also married to a doctor.
Mhm.
So we appreciate each one of you very much. You know, Susan, you and Kyle specifically, you're out on the front lines.
Well, Kyle is, not so much me.
That's really has to be pretty scary. So I thank you for your service. It's almost like being in the uniform. Doctors and nurses are really having to face a lot of difficulties. And I would think a lot of them have some issues when they leave those hospitals, whether that's early in the morning or late at night or whatever. And so I just want to thank both of you for what you do in the medical field and those who work with you in the medical field to help keep people alive in our state. And Kathy, I appreciate everything that you do in terms of following the legislation, following Congress. I've said for years and years that it is so important that business owners understand and know their elected officials, whether it's your county officials, your state officials, and your federal officials. It's critical that you know all of them, because at some time in your life, you will need to contact one of them for something. And you need to contact them is not the time to get to know them.
Right.
Already know them and be able to pick up the phone and call them and hopefully get them on their cell phone.
Yeah.
So thank you for being with us for this length of time. I really appreciate your time. You've been very, very helpful. You've given us a lot of information, and God bless all three of you. Have a good evening.
Thank you. You
Thank
too,
you.
Terry.